All right. This is for Putnam County now session. God bless the United States, God bless Putnam County, God bless the Bible Commission. Mr. Chairman.
Thank you. Invocation from District 8, Commissioner Holmes.
Would you bow your heads with me? Our most gracious and kind Heavenly Father, we thank you for another day of life. Lord, we thank you for the rain that you've given us today. Lord, we ask you to be with our county government tonight, Lord, our county commission as we bring forward business representing Putnam County. We ask you, Lord, to be with our leaders in Washington, D.C., Lord. We ask all this in your sweet, precious name, Jesus. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Clerk, if you would roll call.
All right, ladies and gentlemen, if you'll take your handsets, press yes for me, and just stop right there, please. Press yes and stop right there. Hang on. All right, everybody press confirm for me, ladies and gentlemen. Everybody press confirm. Everybody press confirm. Chevy. Ah, good. Mr. Chairman, we have 23 present and 1 absent tonight. The roll was called. I declare that there is a quorum, sir.
Thank you, Mr. Clerk. Item number 5, approval of the agenda.
Motion to approve.
Second.
Have a motion and a second to approve the agenda. Any discussion? Seeing none, all those in favor say aye.
Aye.
Any opposed, please say no. Motion passes. Item number 6, approval of the minutes of the previous meeting.
Motion.
Second.
Have a motion and a second to approve the minutes of the previous meeting. Any discussion? Seeing none, all in favor, please say aye.
Aye.
Any opposed, please say no. Declare that motion passed. Item number 7, unfinished business and action thereon by the board. Report of standing committees. Planning committee.
No unfinished business.
Thank you, Mr. Chairman. Fiscal review committee.
No unfinished business.
Thank you, Madam Chair. Nominating committee.
No unfinished business.
Thank you, Mr. Chairman. Public comment period. No public comments. Report of special committees. Accept the report from the audit committee.
Mr. Chairman, as required by state audit, the audit committee has to meet and go over the audit. Mr. Sandlin is the chairman of that committee. They met. There were no audit findings. We had a totally clean audit this past year, and he did a report, and it's included in your packet, and that just needs to be accepted by the commission and included in the minutes.
Do I have a motion that we accept the audit as included in our packet?
Motion. Second.
Have a motion and a second. Any discussion about our audit? Seeing none, all in favor, please say aye.
Aye.
Any opposed, please say no. That motion passes. Recommendation from the insurance committee on health insurance increase.
Mr. Chairman, as you know, I told you earlier that we've been working with Blue Cross on our insurance, health insurance, dental and vision. We had a big increase in claims last year when it came to our health insurance, probably the largest we've had in my tenure. Just a lot of different things, sick folks and surgeries and different things. So I've been working with Blue Cross. Sean Bennett's here tonight, our insurance broker, working with him and Blue Cross to try to work the increase down. We started out at about 20-25%. We've worked it down now to about 6.3%. The insurance committee met and reviewed everything, and their recommendation to the commission is that the county pick up that entire 6.3 increase, which amounts to about just a little over $400,000. We have about 523, I think, when you count the roads and county general employees that are on the insurance. Ever since I've been in office, y'all have picked up the increases each year that we've had when we've had one. It's about, if you look at somebody that's on a family plan, either husband and wife or husband, wife, and kids, if you picking it up, it's about a $700 a year, almost like a raise to them if you pick it up. But as we were reviewing this, there was one change that Sean and the Blue Cross came up with that you probably want to hear about. It's an option that would reduce that to $400-something down to about less than $200,000. I just don't know if y'all want to make it or not. So I'm going to let you hear from Sean Bennett, our insurance broker, and hear the proposal and decide what you want to do.
All right, good evening, everyone. Thanks, Randy, for that. So the county general portion, he mentioned the number of the 530-ish. There's 486 employees enrolled on the county portion, or the county general portion of this, for this whole product or this group. 316 of those 486 are enrolled in option 1, okay, and that's the option that we're going to discuss a little bit. The options 2, 3, and 4, the recommendation from the insurance committee and myself and Blue Cross is not to really touch those. And the way this works is a little bit weird. The 6.3 is the total increase, but on options 2 and 3, those options are individually underwritten. All 4 of them are, and 2 and 3 have no increase. So those employees, there's 61 on option 2 and 71 on option 3. They will not see any increase. Option 1, where 316 of your employees are, and option 4, where there's 38, will see a slight increase, and the difference in the first one's the one he wanted to discuss real quick. The options 2, 3, and 4, it's recommended no benefit changes to those, so there's no effect to the employees on those. So there's not really anything to really discuss on those. Option 1, if you renew as is the plan that he's talking about that would be around the $400,000 increase if you pick up the full tab. That has a $1,000 out-of-pocket max for the individual, and it's ×2 for the family or spouse or whatever. So it's $2,000 for every other tier. And first of all, not to spend too much time here, and I apologize for this, but guys, that's unheard of. I've done this for 24 years now, and for someone to have a $1,000 out-of-pocket max is incredible, and you guys are doing a great job keeping that. So you're commending you for that, first of all. The only thing that we're looking at considering that would make the change in that, there are 6 tiers to Blue Cross's drug card. You've got a preferred generic, you've got a non-preferred generic, which are options 1, option 2, okay, on the or tier 1, tier 2. Then you got preferred brand, and then a non-preferred brand are 3 and 4, and then there's 2 tiers of specialty drugs, which are the ones that are just insanely expensive, shots that you give yourself for different, whatever the diagnosis is, and those things are off the charts expensive. Today, you have a $10 generic for option 1 for the preferred and brand. Your first tier of brand name, preferred and non-preferred generics are $10 each today. The first tier of brand name drugs, which is your preferred, is $35, and your second tier, the non-preferred brand drugs, is $50. The change that we're discussing that would make a tremendously large impact on the cost is to take that second tier of drugs, which is your non-preferred generic, and increase it from $10 to $20. The first tier of brand, increase it from $35 to $45. The second tier of the brand, which is your non-preferred, go from $50 to $90. And the groups are tier 5 and 6, both are 50% today. They'll remain 50%. Here's the catch. The out-of-pocket max doesn't change. It's still $1,000. So typically somebody that's in options 5 or tiers 5 and 6 on these drugs, they're meeting their out-of-pocket max in a calendar year anyway, so we're not going to see any effect on those. The only effect we're talking about is some of these tier 2 drugs, which are your non-preferred generics, and then your tier 3 and 4 will increase a little bit as well. Okay, so that's the cost that would be, I guess, seen by the employee if they are taking any of those drugs. If they're not taking any of those drugs, then there's no effect to them. Did you guys follow that or have any questions for me? Yes.
I don't think I quite understood what you said correctly.
Okay.
So if we do this and these drug costs go up slightly, or to some degree, would that affect the out-of-pocket max?
No.
It would not. So basically, they just meet their deductible faster.
Yes.
Okay.
That's the low, easiest explanation of it.
If they're taking one of these drugs that shows the higher cost, they would just meet their deductible faster.
Yeah.
And when they get to their max, then it's covered.
Yes, sir. And if they're on the preferred generics, those are not changing at all. It's still $10 at that point.
Sure. I couldn't hardly hear what Jonathan was saying. If I've overstepped, repeated what he said, I apologize. Does any of the cost of the drugs go towards the deductible, or is that the deductible in itself?
No copays actually go towards the deductible. However, they do go towards the out-of-pocket max.
Out of pocket, okay.
Yes. No copays. That's office visit. That's any copay. It does not count towards your deductible.
So the difference in the cost between A and B, or the 1 and 2, is what per year?
For the county portion?
Yes.
It's almost 200. It's a little over $200,000. We have that exact number in front of us. Randy? Okay, it's around $200,000. I don't have the exact number in front of me right now. I apologize.
It was a little over 200.
Yeah.
So it cuts it in half.
You're asking about the dollar amount?
Yeah, the dollar amount,
Or what?
not the premium.
So it cuts the county's portion by half.
Oh, yes. Yes, absolutely.
Yeah.
Mr. Jacinto.
I was just curious, did we have a committee that looked at all of this? What was their, on the commission? I'm just curious.
Yes.
What is their recommendation? I would assume that they looked at this
They
close.
didn't have a recommendation on this. They recommended the county pick up the portion, but they didn't have a recommendation on this. They wanted y'all to hear this since it's effective in the board.
Our plan last week in that committee, Vinny, was to really come before you guys and ask. The main question is to pick up the full amount for the employees still. But really, this is kind of
$1,000 annually.
it does affect the employees if they're taking one of these specific drugs, but it's not a huge impact
So
on them.
just a couple of quick follow-ups then. There was 361 people.
Yes, 316, yes.
That are affected in this. How many people in the county are eligible for the insurance, Mayor? Which is how many employees?
Full-time employees, yes.
Yes.
All full-time.
How many full-time employees does the county have? I'm just wondering what percentage of them are covered under the insurance is what I'm getting at. So of the 361, is it half of our workforce, a quarter of our workforce?
So I can speak to that to some extent. I don't have the full number because I'm obviously not HR from that standpoint, but you guys, gosh, you're over 90% of your overall employees that are covered on the plan. There's 486 on the plan.
Barely.
In county general, and 316 of those are in option 1, which is 65% of the county general employees are covered in option 1 of the choices.
So using the mayor's quick math on a family plan, if they absorbed the entire increase, it'd be $58 a month each. $60 on a family plan, and I'm sure some of them are on husband and wife plans or something like that.
Well, actually, that $60.20 is on the individual. The family plan would be $113.35.
So the advantage to doing it the way that he was just describing is that the extra drug costs would go towards their max out of pocket as opposed to just giving them the rate increase.
So does that count on our out-of-pocket?
That, yes. Anything you do, it does not count towards the deductible. No, it's copays don't count towards the deductible.
In other words, your medication for the employee goes up.
For some tiers, yes.
Yes, on the,
Yep.
yeah.
So I don't want, this is a conversation we had last week, and I don't want to sound heartless, guys, so please don't take it that way, and I'm not trying to be heartless, but the deductible on that plan is $500 on the individual and $1,000 for the family. Again, it's unheard of anymore. I've done this for 24 years, and this plan, my personal plan that I have with Blue Cross is way higher.
The county pays part of their insurance, and then we pay part of our insurance. The county don't pay all of it.
No.
That's what they're not, some people don't understand.
Please remember to use your handsets. Commissioner Donadio.
Yeah, real quick. For the meds that are going to have the biggest boost in their cost, are we talking the tier 3?
Tier 3 would only go up $10.
Okay.
The biggest increase would be on tier 4, which goes from 50 to 90.
Okay. So examples of those meds, are those like your GLP-1s kind of medications?
Yes,
or-
those are your preferred brands that are non-preferred brands. They're a little bit more expensive, but they're not in that 7-year window to where.
Gotcha, so they're still on patent?
Yeah.
Okay, great.
Yeah, you're talking about the ones I'm talking about that are the 50% are the injectables for, say, leukemia, where it's $10,000 a month, example.
Okay, gotcha.
That kind of drugs.
All right, and as of now, do we have any idea how many of our workers this is going to affect, or how many are using those type of meds? Do we have that number?
We don't have, so the way that this is written right now, or the way we get your reports right now, the reporting, it gives us a specific number for the generic drugs, which is your generic drug utilization is really high. It's off the charts. It's over 80, it's like 88% at the low end. Typically, it's closer in the 90s. So most of these drugs we're even talking about, it's not going to affect them.
I was about to say, it should be a pretty small.
It's going to be, it should be minimal. Now, I say that, and of course, when the employee goes the first time and they're hit with $20 as opposed to 10, it's going to be a little bit of a shell shock. I get that. But the larger claims that we're talking about, those folks won't be impacted at all because they're meeting their out-of-pocket max anyhow every
Right
year.
off the bat. So. Okay, thank you. I appreciate that.
I'm sorry, just
Any other discussion?
just one more quick. If it's my
Vinny, if you would, you've already spoken. Let me see if anybody else wants to speak, and if not, I'll come back to you. Anybody else have any questions? Vinny, go ahead.
To Teresa's point, what is the share between county and what the county's paying?
You have that on your iPad. There's an insurance spreadsheet. So for the best plan, the $500 deductible, $1,000 out of pocket, if you and your spouse, if it's two of you, you pay $299.91. The county pays $1,116.46 of that plan. If it's a family plan where you're covering you, your spouse, and all your kids, it's $406.65. The county picks up $1,535.25. I mean, and I'll say this, we talked about this in the insurance committee. This is one of the reasons we've been able to attract and keep employees is our insurance plan. Especially over the years when the raises weren't that good, people were staying because TCRS retirement, we still got the old retirement that's been there for years, and the health insurance plan. But
Thank you. That was my question.
Sure, go ahead.
Just so this isn't left out in the cold, and this needs to be said, the reason why we look at any of these changes isn't simply because of the cost of the county, it's the long-term solvency of your plan. For years, this $1,000 out-of-pocket max is kind of the root of Blue Cross, if you will, but they've been a great partner to you guys, and the fact that you can keep it, actually, it's kind of strange how it's going now. It's almost like they're cheering you guys on to be able to keep this at this point. So that's the only reason this came up was because we're seeing if there's minimal ways to save money or minimal ways to impact the employees, but also keep the county to where you're not eating this whole increase. And Randy spoke to this a brief moment ago. Guys, your claims were off the charts higher than they've ever been. So when they came out with these numbers and they came with this final number, but my recommendation as your broker was take this and run before they change their mind kind of thing. So, any other questions?
Mr. Andrews.
I can just say 10 years ago when I retired, I was paying $400 for the family plan, so this is pretty sweet.
Can I make a motion?
Absolutely.
I'd like to make a motion, we accept the secondary plan as presented by him there with the increase in those medications. And the increase of, is $180,000 to the, and that the county would go ahead and accept that from County General.
I have a motion. Do I have a second?
I second.
Oh, we have a motion and a second. Do we have any discussion on the motion? Darren?
Okay, so are we talking about the $400,000 increase?
No, the $180,000 increase.
This $400,000 increase is coming out of which? And this funded by sales tax and property tax as well?
all the revenues that come into county general.
But it would be 180, not 400,000, because we'd have a slight increase in those medications.
My biggest thing is, finishing up, my biggest thing is, and I've said it before, when we did the last pay increase, is our employees are our biggest asset. And I want to make sure we maintain that. And if the funds are there now, I'm going to vote against that and for the full. Just my thoughts.
The motion is to accept the second option as presented, which
Amends the drug card slightly.
it changes the drug cards.
On option one only.
The county has 4 plans that an employee can accept. This changes the drug card only on option 1, which is far and away the most used plan. Probably 70% of the employees are in that. And this would change the drug card slightly, which, assuming the county picked up all the cost, would change the cost increase from $400,000 to approximately $180,000.
But will we be picking up the 707 for the employee?
We would be picking up all of the increase. The county would be with this motion. But it would be changing the drug card slightly.
So, yeah, just on option
Yeah,
one. 2, 3, and 4, options 2, 3, and 4 will receive no change whatsoever on this.
Ms. Dunn?
So I just want to be clear. Yours 180 is a substitute to the 400 that
That is
the reporter
correct.
was talking about,
That's
correct?
correct. It's 180 rather than 400, and you're going to see a slight increase in the drug costs for those specific types of medications.
But those co-pays will go towards their total annual $1,000 out-of-pocket
Yes, ma'am.
max.
Correct.
Yes, ma'am. That's the key.
All
cost.
their drugs will?
Yes.
On this one?
100% of everything goes to your out-of-pocket max. As long as you're in network, if you have an out-of-network expense, it's a whole different game. But that's what the impact is that I probably didn't do a great job of telling you this. This is such a minimal impact because that $1,000 out-of-pocket max does not change. And again, I have a heart for the employees. I understand that. But also, guys, David, you spoke to this briefly a second ago. This insurance doesn't exist anywhere else. The way it's the charge the employees are paying for this and the quality of it is off the charts good right now. I don't see this anywhere. So you guys are doing a great job.
Maybe I'm confused.
Hey, hold on 1 second,
Oh, sorry.
Mr. Randolph. Mr. Randolph,
She asked the question that I was going to ask.
before I come back to you, David, does anybody else have any questions or comments? Commissioner
What about I'm confused here, the 400 and 180, what did I lose here? I was probably talking when I should have been listening.
So the 400 is if you change absolutely nothing on the plans. If they renew as is, that's what the cost would be, around $400,000 to the county general fund. If you make this one slight amendment to the drug card on option 1 only, then it would cost the county closer to 180. That's the difference.
But it's going to cost the county, the employee more on the amendment we have.
If they
use
have
those drugs
drugs in that specific tier.
Mm-hmm.
But you're still talking about $20 copay. So if you've got people that's got 2 or 3 children and they all 3 get sick with the flu or something, you're talking about $60 for a prescription, maybe $120 for a prescription.
If it's in that tier 2, yes.
If it's those type of medications.
Yes.
The medications he's talking about are pretty slender.
Okay, can you, sorry, Kathy.
No, go ahead.
Can you go back over the prescriptions that he's discussing?
Sure. So there's 6 tiers to each drug card for Blue Cross, okay? Tier 1 is your preferred generics, which is $10, and that's the cost on both plan options.
And that's going to 20?
No, not on option 1, not on tier 1.
Option 1, okay.
Tier 1's your preferred brand. They will still be $10. So it's $10 both ways.
That's the $400,000, right?
That's both. There's no difference in
So
tier 1.
tier 1 is irrelevant on, okay.
Completely the same.
Got
Okay.
it, go ahead.
Tier 2 is there's a non-preferred generic drug, okay, and I can give you an example of one of these because I've seen this cost, is some of these AD&D drugs, ADD drugs are expensive, and if you don't have like on my plan, I've got a HSA plan, so I'd be similar to option 4. Some of those cost $200 even on a generic basis. Those type drugs that are in tier 2 in this $180,000 scenario go to $20 as opposed to $10. Okay? So they're your more expensive generics that are out there. Tier 3, which we're getting in, there's 2 tiers of brand name drugs. There's 3 and 4. Okay, today, Tier 3 is $35. If we make this adjustment, Tier 3 goes to $45. Okay? And Tier 4, which is your non-preferred brand, goes from $50 to $90 if we make this adjustment. Wow. All right, now let me say one more thing real quick that this doesn't really matter to you guys right now. It does at the school, and if Corby were here, he could echo this. Guys, the second drug card that we're talking about is still better than what the state offers their employees. It gets more in line with what they're offered today. Okay? That $45 that I'm saying versus $35 is what the state plan employees are paying for those drugs. That $90 is what they're paying for those drugs. Your guys' plan is so much better than the state plan, it's not even close today, and it still will be after this, because they don't have $1,000 out-of-pocket max. Yes?
So what's their general practitioner copay?
Your office visits are different on each plan. The office visits are not changing on any of these. We're not discussing any change to that at all.
I'm just trying to think, having had small children myself who had asthma, and our out-of-pocket costs every month were astronomical.
Sure.
And I don't want our employees.
Question would be at that point, are those people meeting the out-of-pocket max anyway? If they are, then we're not talking, we're discussing that.
$1,000 on a family, $500 on a.
Thousands out-of-pocket max on the individual.
After $1,000, it's 100%.
100%. So if they're getting there anyway today, honestly, guys, here's what I want you to hear out of all this whole discussion. If they're meeting their out-of-pocket max today, this does literally nothing to them. They're still going to meet their out-of-pocket max.
And one of our employees, no matter what their illness was, would not have to spend more than $1,000 in a year for their entire family on health care.
$2,000 for a family.
$2,000
That's times 2, yes. But no one person is responsible for more than the individual amount. So no one person that gets sick will spend more than $1,000 as long as they stay in network. Okay?
Any other discussion?
The insurance committee recommended what?
The insurance committee recommended that we bring this to you and you guys pick up the full increase either way. And then they brought this forward with discussion so that you guys, honestly, I'll just tell you too on that, my suggestion was to bring this to you guys to let you guys have input on what the decision is here on this. Not just they wanted the full increase, that's what the insurance committee is bringing forward, either way. So the 400 or the 180,000 is what they're recommending, and they wanted you guys to have input and discussion on this choice. Was that fair? Okay.
Any other discussion?
I got a question. So are you saying once they pay their $1,000 out of pocket, the medicine's free? Or they're
Yes,
still gonna
everything's free.
Everything's free.
Everything's free. Here's a good example.
So basically, if we go with the plan that's been presented, it's going to cost us $200,000 less.
Yes.
Okay. But what that is going to meet, they're going to get to that $1,000 quicker.
Yes, if they're meeting it
and then
anyway.
they're going to get it free. And we're going to be out less money.
Yes.
Okay.
Let me give you an example. Okay, my knee surgery, because I'm the lucky person that goes and has a knee surgery when I tore my ACL and I got admitted for pneumonia to the hospital overnight because I'm that lucky person. It was well over $15,000 for the stay and all the other stuff. On this $1,000 out-of-pocket max, once I hit $1,000, that's all I'm billed. The other $14,000 something gets paid for by insurance. So.
Any other discussion? Before I call for the vote, just a reminder that if you or your family are covered under this plan, if you're a county employee, you cannot vote on this motion.
Is it immediate?
Why?
Immediate family.
Why?
Yeah, immediate family. If you commingle funds.
You're not talking about sisters, brothers.
Your sister is not, no, she's not in your household. I'm assuming y'all don't commingle money, so no, that will be fine. I will say, when we get to the budget time, this applies to people that work for the school system as well. This specific motion would not apply to the people that work for the school system because they're on a separate insurance plan.
You can vote for a general budget. This is a specific item, so that.
Is that full-time employees? For
I mean, it's just like when we vote on budget. My guess is Teresa's the only one that is affected by this. Am I missing
Okay.
somebody?
Yeah. Oh, is there any others?
Okay, and TR said you don't have to.
Okay, yeah.
Could you repeat the motion and then with your motion, tell me what the total cost of this motion is going to be, please?
Okay. The motion as it stands now is that we go with the secondary plan presented, and that would be the county's cost would be $180,000. The employees would see an increase of their copayment on certain medications within certain classes, but their copay stops at $1,000 for an individual, $2,000 for a family. Did I explain that correctly?
Yes.
And no increase
Out-of-pocket
in
match.
monthly premium.
I'm sorry?
No increase in monthly premium.
No.
No increase in the employees.
Can I state one more thing, Chris, real fast?
Quick.
I will be as quick as I can, I promise. Guys, we're not trying to do this to make some huge change to the plan. We're just trying to find ways to help both parties involved. That's all this is. It's a recommendation. We're good either way you go. It's just a recommendation.
So that's the 400,000 and not adding on the 180,000?
No.
No.
With this motion, that's what I'm trying to get at.
No, that's 180,000 as opposed to 400.
He's doing the 180, not the 400. Yeah, that's what he said.
Terry, if we make no change to the plan as it exists now.
With this motion?
Well, if we make no change to the plan as it currently exists, the county increase would be $400,000. With this motion to accept the alternative drug card, that lowers that $400,000 to approximately $180,000.
I mean, no offense, but some of us don't hear you very well up here.
Okay.
It's not you, it's this.
No worries at all, I promise.
Okay. Thank you.
One more clarification. $1,000 out-of-pocket max is met. They go to any doctor, they don't pay a copay or anything at that point.
They've met their out-of-pocket. It's a maximum.
All right, I just wanted to
As long as-
clarify there
again-
would be no more copay.
Again, I can't say this without, as long as you're in network.
2,000 per family, okay. All right, thank you.
Okay.
So let me ask a question as a county official and got an office full of employees. So if this passes, what does this do for my employees that are on the insurance as far as any cost increase?
The only thing that would increase is if they're in option one.
Okay.
If they're in option 2, 3, or 4, absolutely nothing changes.
Okay.
If they're in option 1, only some of the drug tiers would change.
Okay.
If they're not taking any prescriptions, then nothing changes.
Okay. So if they're in some generic stuff?
Yep.
In tier 1?
Well, tier 1, yes. Tier 2, they could have a $10 increase
So,
on that.
a
Now, if they've got
$10
some sort of treatment they're undergoing, say cancer, say heart stuff.
Okay,
still
so that
nothing.
10 goes to 20?
Mhm.
Okay.
On tier 2.
Until everything is met and then it goes back?
Yep.
Okay. We've had so much back and forth. I got lost in the drug card to make sure. I just want to make sure that county employees are not, I appreciate the county, I appreciate you all eating this. County employees, we still got some that are, they still struggle. They still struggle. So they need all the help they can get. Thank you.
Question?
Question has been called. Mr. Clerk, would you call? We'll do this with roll call vote.
All right.
Call the roll, please.
Take your handsets. If you favor this motion, vote yes. If you do not favor the motion, vote no. Everyone, please vote, and please stop right there. Just stop right there once you vote. All right. All votes are in. Does anyone, anywhere, wish to change their vote at all? Now, please press confirm for me, ladies and gentlemen. Everybody, please press confirm. Mr. Chairman, you have 20 voting yes, 1 voting no, 2 abstain, 1 absent. I declare that motion to have passed.
Item D, under unfinished business. Any other unfinished business? Item number 8, new business and action thereon by the board, report of standing committees, planning committee.
Thank you, Mr. Chairman. Planning Committee recommends approval of the resolution allowing Putnam County to purchase using purchasing cooperatives, and I so move.
Second.
We have a motion and a second. Any discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Motion passes. Mr. Chairman?
Oh, I'm sorry. No, that concludes planning.
Thank you, Mr. Chairman. Fiscal Review Committee.
Thank you. Item A, recommends approval of budget amendments to the county general fund, and I so move.
Second.
We have a motion and a second to approve the budget amendments to the county general fund. Any discussion?
All right, seeing none, take your handsets. If you're in favor of the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote, and stop right there for me, please. Mr. Eldridge. Hang on. Wait. Mr. Eldridge. Hang on, guys. Jeb?
Teresa, sharp elbows.
Oh, there we are. Almost are in. You just got to hit that spot at the right spot. All right. Go ahead and press confirm for me, ladies and gentlemen. I already know what you're doing. Yeah. Everybody press confirm. All right. Good job. They get cantankerous every once in a while, Shevin. Sorry about that. Mr. Chairman, we have 23 voting yes, 0 no, 1 absent. When the roll is called, I declare that motion to have passed.
Thank you. Item B, recommends approval of budget amendments to the general purpose school fund, and I so move.
Second.
We have a motion and a second to approve the budget amendments to the general purpose school fund. Any discussion?
All right, seeing none, take your handsets. If you're in favor of the motion, vote yes. If not in favor of the motion, vote no. Everyone, please vote. Stop right there. All votes are in. Anyone wish to change their vote anywhere? Now, please press confirm, ladies and gentlemen. Everybody press confirm. You're doing great. Mr. Chairman, we have 23 voting yes, 0 no, 1 absent, and I declare that motion to have passed. Madam Chair.
Thank you. Item C, recommends approval of bid on earthwork and utilities for the bus garage and the county maintenance facility, and I so move.
Second.
We have a motion and a second. Any discussion on the motion to approve the bid for earthwork and utilities? Mr. Bennett.
I just want to confirm that the county maintenance facility is combined with the county highway department,
Yes.
because we talked about 3 different buildings.
Putting them together, well, 2 buildings.
Well, 3 different operations.
3 different operations, but 2 buildings, yes.
Okay, thank you.
But we're not bidding the buildings.
Right, I just want to make sure,
Yeah.
that you don't mention them in here, just make sure that highway department's included in that.
Mayor, who was the winning bid on that? Can you, are you able to say yet?
Well, if y'all vote on it, it's Rogers Group.
Okay.
Any other discussion?
All right, if you're in favor of the motion, take your handsets and vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. Stop right there for me. All votes are in. Anyone wish to change their vote anywhere, please press confirm for me, ladies and gentlemen. Everybody press confirm. You're doing great. Mr. Chairman, we have 22 voting yes, 1 no, 1 absent. I declare that motion to have passed.
Thank you. Item D, recommends approval of Putnam County share of the grant match for the airport, and I so move.
Second.
We have a motion and a second. Any discussion? Mr. Clerk?
All right, seeing none, take your handsets. If you're in favor of the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. Stop right there for me, please. All votes are in. Anyone wish to change their vote anywhere, Please press confirm for me now, ladies and gentlemen. Everybody press and confirm. Mr. Chairman, we have 23 voting yes, 0 no, 1 absent. When the roll is called, I declare that motion to have passed.
Thank you, and that concludes fiscal review.
Thank you, Madam Chair. Number 3, nominating committee.
Nominating committee has no business tonight, Mr. Chairman.
Thank you, Mr. Chairman. Report of special committees. Resolutions.
No resolutions, Mr. Chairman.
Election of notaries.
Got quite a few. Here we go. Erica C. Agee, Beth Allen, Curtis P. Armstrong, Wendy H. Bandy, Shauna Block, Victoria Bostic, Scott Chaffin, Al Cochran, Angela Diane Kaufman, Hannah David, Amy L. Dyer, Kimberly Ewing, Debbie Gall, Kyle D. Greer, Jeffrey Dwayne Hagan, Michael T. Hall, Sean Hudson-Pillar, Danielle Huffines, Regina Ann Johnson, Brittany Franklin Key, Kimberly McQuiston, Ella Moore, Jennifer Murphy, Ellen Noose, Melissa Lee Phillips, William Franklin Phillips Jr., Jason Fye, Marty A. Pittman, Lisa Russell, Sarah Shaw, Lacey Ann Stapleton, Jason C. Stewart, Sandy K. Thompson, Matthew M. Whitson, and last, Deborah Wittenberg.
Motion to approve.
Second.
We have a motion and a second to approve the list of notaries. Any discussion?
All right, take your handsets. Just go ahead and vote yes, if you would, please. All you're doing is confirming what's already been confirmed by Miles. Now go ahead and hit confirm, if you would, please, ladies and gentlemen. Everybody press confirm. Palm off. There you go. You did good, Bob. I'll tell you, I'm so proud of you. All right. And thank you, by the way, for your handsets. Send them down this way when we're over. Mr. Chairman, I have 23 voting yes, 0 noes, 1 absent. Motion passes.
Thank you, Mr. Clerk. Any other new business?
I always bring to you, usually in the month of April, revenue. You have a file on your iPad that is the revenue for the first 9 months so far in all the funds. If you want to, I'll briefly, I know it's run a little later tonight, but I'll briefly run through it. If you have questions, you can always call me or Chelsea, the one, and we can talk you through it. So if you're looking at that file, at 9 months of revenue, you should be at about 75% on the percent of budget. We've got some line items. Some of them are doing really good. Some of them are about what we thought they'd be budgeted, and some of them are not so good. So I'll run down through some of them. Property taxes at 98%, which is about where we should be this time of year, because all your property tax is collected in November, December, January, and February, so we've done real good on it. As you go down the line, some of these, clerk and master collections being lower, she'll get quite a bit more in the next 2 or 3 months coming in. But the lower her collections are, sometimes it's the better, because that means people are paying their property taxes on time, not them being as late. Local option sales tax is up about 4%. Only a small portion of that goes into county general. The biggest part of it goes into debt service. I don't know if it's the trend that we're going to see or not. The last month was down 3%, but it's been being up about 4%, so we don't know. We'll have to wait another month or two and see if that's going to change or not. As you go down, business tax, biggest portion of it comes in the next couple of months. We're about where we were last year, so expect it to be about what we budget. Bank excise tax came in a little better. So as you go down through there, building permits, of course, have been really good, and they're above what we budgeted. Anything above 75% is good. Anything below 75% is normally not good, except for a few of these lines that we'll talk about that they don't come in. We don't start seeing some of that revenue until later in the year, Cable TV franchise is paid every other month, and so we won't see, it'll come in about where we thought it was. As you go on down, some of the fines are lower, some of them are up. I don't see anything else on page 1. Go to page 2. Patient charges are up, even though Tommy's seeing his call volume kind of level off, doing a pretty good job on collecting on the EMS charges. Going on down the line.
44,990.
40, tell me again.
Other local revenue, 44,990, 1%.
44,990. So that is when 911 reimburses us. If it's bolded in black, it's a set fee where 911 reimburses us at the end of the year for their 60% of the dispatcher salaries and benefits. Investment income at about halfway down that second page. Been doing good on the interest. I budgeted a full point less on the interest rates, thinking they were going to drop them, and of course they did. So we're going to come in okay on our interest rates. I think we just got to watch those going forward should the Fed decide that they drop interest rates. You know, we're probably going to bring in somewhere around $5 million in interest. 2 years ago, we was bringing in $130,000. So a lot of our revenue that comes into county general is based on interest that we're bringing in on our reserves that we have, our fund balances. Sale of equipment, that's up and down, depends on when the departments sell stuff and surplus equipment, so it's hard to budget that one. Most of the other stuff is doing pretty good. Of course, the sheriff told you last month or a month before last about the inmates on the federal program is going to be less than what we budgeted. I think the interest is going to make up for that one though, so they'll probably even themselves out. So if you start looking at county general on end of page 3, we're at 89%, which is about where we should be, a little better than probably what we normally are on county general, but we still got 3 more months to go. The other ones, they're basically just a mirror image of what county general is. Solid waste, industrial development, all the other little funds. They get a portion of the property tax, and some will get a portion of the hotel motel tax, and some will get a portion of the sales tax. So when you start looking at all the other funds, we're doing pretty good. Still got 3 months to go though. When you go to the very final page, you're looking at, we budgeted almost $104 million. We're at about 91.4, but we've still got 3 months to go. So we're going to collect more than what we budgeted. But as I told y'all, especially the ones that are on commission, I always budget very conservatively when it comes to revenue. Because the one thing I don't want to happen is us to budget too high and we don't come in on revenue. So out of all the 10 years that I've been county mayor, we've always brought in more revenue than what I budgeted, but that's on purpose to make sure that we're okay in our budget. So you may have any questions on any of the things. I'm let's run through it pretty fast, but anytime you have any questions, feel free to call me, or Chelsea will be glad to answer any of them. Okay.
Any other new business?
No, sir.
Announcements and statements. Just a quick reminder that the Budget Committee is going to be meeting on the main level in the conference room, and Awards Committee will be meeting afterwards. Where's the Awards Committee meeting? In here. If there's nothing else that needs to come before the commission, I would entertain a motion to adjourn.
Motion to adjourn.
We are adjourned.